we are working in Migori County, and REPOD is a non-governmental organization in NGO. Now, alongside the malaria project implementing with the Amref, in partnership with Amref, we are doing other programs, which I will not talk about today. But we are of interest today is the project we are doing, funded by Global Fund to Amref, and at the county level we call it, the name of the project in Migori County, Integrated Malaria Project. Yeah, so far we are, like I've said, implementing in Migori County, implementing 3 sub-counties, but we are yet to establish, we are yet to make inroads into the third sub-county, that is Suna West, but currently we are still working in 2 sub-counties. So we, as the civil society, we are facilitators in this project. So the Minister of Health is the major determinant of where the project is implemented. So far, the Minister of Health in Migori, because in Migori has given us the sub-county we are working in as Suna. So just to elaborate, we work in community units. We work with community units. So we work with we implement in community units. So the community units are given to us by the Minister of Health. So it happens that in Migori, we are given all the community units in Suna East sub-county. So they are yet to give us more, and hopefully they will give us others in the other sub-counties. That is Suna East, Suna West. There are several factors that come into play as far as malaria is concerned. First of all, the temperature is conducive enough for mosquito breeding, the vector breeding, and the mosquito that causes malaria. And also, malaria is with us partly because of the way of life of people. Like you say, sometimes we can say that the culture also contributes. Like when nets are distributed, you find out that there's cultural aspect that control, like who uses the net. Yeah, maybe there's one net in a house, in a homestead, and the homestead has several households. Yeah, like the polygamy, there's polygamy in the area. So you find a man has several wives, and each household has a mosquito net, or you can find that only one household has mosquito net. So the mosquito net is may be used by the man. Yeah. So that power relation within the homes contribute to malaria. So you find that the children cannot access the net. Also, the population. Yeah, maybe the nets which are distributed are not enough to be used by all the not enough to use by all the population, all the children and the people living in communities or in the homesteads. So you find some people will be able to use the net, and some people will be able to use the net. Then also poverty. Poverty is also a major contributor to prevalence of malaria, in that some people are not able to access the much needed healthcare services, maybe because of, we know that the government of Kenya provides malaria drug, but then sometimes the geographical location of maybe where somebody lives and proximity to the hospital, it may be far. The hospital may be far, so that it's not accessible, easily accessible by the population because of transportation and other benefits. Let me say the last one. When the nets are distributed, sometimes we find out that brand new net is being used to protect vegetable. So you see the phenomenon of instead of mbu nje na sisi ndani, we have kuku nje mboga ndani. So you see that situation when you walk around. So those are some of the things we are working with community units to stamp out. Yeah. is to at least sensitize people, tell them the importance of the use of the nets. Like I was saying, Amref, we use community health strategy to tackle malaria cases at the community level. So our main work at the community level is to diagnose and treat malaria. So the diagnosis is done through RBT, the rapid diagnosis test. So Amref provides us with rapid diagnostic test kits. So the CWs are trained on diagnosis of malaria and administration of ARs. So we after they are trained, they walk, they go to the field, the household they man. So during their home visits, when they find a person with symptoms of malaria, they test using RDT kits, and then they administer drugs. If the person tested turn positive. So having said that, we would like Amref to increase the targets, because right now we are working with community workers, and we're working in 20 community units. Each community unit consisting of 10 community health volunteers. We are working with 20 community units. Each community unit consisting of 10 community health volunteers. That means we are working with 200 community health volunteers in Migori and Omondi.
So do you want Amref to increase the number to what? From 20 to what now?
Maybe to 40. Should the number increase to 40, we will really be able to capture, to also spread to spread more, and to implement the malaria activities adequately, and to cover almost 80% of the Migori county.